The patients that I see for arthritis at the base of the thumb generally break down like this. There are about 4 to 1 female to male, and the ages range from 45 at the youngest end to 75 or so, with an average at about 60 years old, which is fairly typical for arthritis at the base of the thumb. I am seeing increasing numbers of younger patients in the 50 to 60 range over the years. I do see some active patients, some that work at Toyota, building cars in the next town north of me in Georgetown, Kentucky. But interestingly, many of the patients that I see that are over 60 are retired, but they have very active interests. They are involved in fishing, they play pickleball. It seems like everybody is building a deck this spring. And so there are a lot of people with a lot of very active interests, and they all come in with pain at the base of the thumb. The way I make the diagnosis for thumb CMC arthritis is very similar to the way you would think. It's pain at the base of the thumb. It involves tenderness and visibly enlarged thumb CMC joint. There may be some subluxation to it. Everybody that I see that I consider for surgery has a positive CMC grind test. And the way I do it, I'll show you on the next slide, has some increased sensitivity and specificity, which is really important when you deal with people who have pain in the thumb or in the wrist, to differentiate exactly where that pain is coming from. Typically, their x-rays will have osteophytes, loss of joint space, typically Eaton stage 2 or 3, arthritis at the trapeziometacarpal joint. But you have to be sure that that is where the pain is coming from. Otherwise, you won't be treating the right condition. So most of us were taught the thumb CMC grind test, where you stabilize the trapezium with one hand, and then with the other hand, you would circumduct the thumb and put a little bit of pressure on the thumb so that it allows for contact between the trapezium and the metacarpal. But a lot of times people won't say that that hurts, or that won't necessarily be positive. But if you add this step to it, you place your thumb on the dorsal aspect of the thumb metacarpal base, like it is in the diagram, that will reduce and stabilize the subluxation, the dorsal subluxation that often happens with arthritis. And then just by lifting the thumb, you put a concentrated sliding force of the thumb metacarpal in a palmar direction on the trapezium. And this universally, in patients who have severe arthritis, will cause crepitus. It'll cause pain. They'll typically jerk their hand away. They'll say, ow. And you know that that is where the pain is coming from, because you'll ask them, is that the pain that you're talking about? And they'll say, yes. That's a very specific test under those circumstances, and it's very helpful in diagnosing and differentiating thumb CMC arthritis from anything else.